One of the most frustrating things that I hear from a lot of clients is how many different doctors they've been to with no answers, how many different tests, often ending up with only Google and Reddit to try to do their own research and find answers, meanwhile prolonging their suffering, their pain, and their issues. Hey you guys, I'm Amy Van Der Linden with Moment of Truth Physical Therapy. I'm a pelvic floor therapist, and today we're going to get into some of the male pelvic floor anatomy and functions and how helping you know your own anatomy will hopefully avoid some of the other rigmarole and prolonged suffering and issues that often happen for so many of the clients and people that I'm speaking with. So men, I'm talking to you guys today. You have 2 layers of pelvic floor anatomy. I won't bore you with all the technical names, but the reason that's so important to know that is because I think so many times we don't know our own bodies, and so we don't understand when things start functioning differently or something's going wrong. And so again, that goes back into you end up bouncing around doctor to doctor, blood work, tests, oftentimes things that are very painful and interfering with your health and your sex life. And so we don't want that for you. So I just wanted to take a minute and explain some of that muscular structure, because just like your pec, your bicep, your quad, your hamstring, your glutes, those muscles can become tight, they can become weak, they can become overly restricted, they can become inflamed. And so just like you would need to treat a shoulder injury or any other kind of muscular issue, the pelvic floor might need to be treated. And we're not taught that, and we don't know that. And so a lot of times we're just bouncing around looking for answers and ending up on antibiotics as they try to rule out UTIs or epididymitis, STDs, things like that. Again, meanwhile, you're in pain and things are not going well with your pelvic floor. So the pelvic floor muscles are obviously important for bowel and bladder function. They're important for sexual function. And so when you have issues going on down there, we want to make sure you understand your own anatomy and can help yourself. So stay tuned. We're going to get into more of the problems you might be facing and some of the solutions that you can do on your own to help yourself stay healthy and active.